Today, we're diving deep into the world of antibiotics. We'll explore the different classes of antibiotics, how they work, and their specific uses. Let's get started. First up, we have penicillins. Penicillins work by inhibiting bacterial cell wall synthesis. They bind to penicillin-binding proteins, preventing the bacteria from forming a protective cell wall. Examples include amoxicillin, penicillin G, ampicillin, oxacillin, and piperacillin. Penicillins are commonly used to treat respiratory infections like pneumonia, skin infections such as cellulitis, and urinary tract infections. They are also effective against streptococcal infections and syphilis. Next, we have cephalosporins, which also inhibit bacterial cell wall synthesis. They are broad-spectrum antibiotics, effective against a wide range of bacteria. Examples include cefalexin, ceftriaxone, cefuroxime, cefazolin, and cefepime. Cephalosporins are used for respiratory tract infections, skin infections, intra-abdominal infections, and surgical prophylaxis. Ceftriaxone, in particular, is commonly used to treat meningitis. Macrolides inhibit bacterial protein synthesis by binding to the 50S ribosomal subunit. They are effective against both gram-positive and some gram-negative bacteria. Examples include erythromycin, azithromycin, and clarithromycin. These antibiotics are commonly used for respiratory tract infections, including atypical pneumonia, skin infections, and sexually transmitted infections like chlamydia. Azithromycin is often preferred for its shorter treatment course and fewer side effects. Fluoroquinolones inhibit bacterial DNA synthesis by targeting bacterial DNA gyrase and topoisomerase 4 enzymes. They have a broad spectrum of activity. Examples include ciprofloxacin, levofloxacin, moxifloxacin, ofloxacin, and norfloxacin. These are used for urinary tract infections, respiratory tract infections, gastrointestinal infections, skin infections, and even bone and joint infections. Ciprofloxacin is notably used for treating anthrax. Tetracyclins inhibit bacterial protein synthesis by binding to the 30S ribosomal subunit. They are effective against a wide range of bacteria. Examples include doxycycline, tetracycline, and minocycline. They are used for respiratory infections, acne, Lyme disease, Rocky Mountain spotted fever, chlamydia, and even as malaria prophylaxis. Doxycycline is particularly useful due to its broad spectrum and good oral bioavailability. Aminoglycoides inhibit bacterial protein synthesis by binding to the 30S ribosomal subunit. They are mainly effective against gram-negative bacteria and are often used in combination with other antibiotics. Examples include gentamicin, amikacin, tobramycin, streptomycin, and neomycin. They are used for serious infections like sepsis, endocarditis, and hospital-acquired pneumonia. Tobramycin specifically is also used for eye infections in the form of eye drops. Lastly, we have sulfonamides, which inhibit bacterial folic acid synthesis by acting as competitive inhibitors of dihydropteroate synthase. Examples include sulfamethoxazole, sulfadiazine, sulfasoxazole, and sulfacetamide. These are used for urinary tract infections, respiratory infections, pneumocystis pneumonia, nocardia infections, and toxoplasmosis. Sulfamethoxazole is often combined with trimethoprim to form cotrimoxazole, a powerful combination used for various bacterial infections. Before we wrap up, let's talk about some important considerations when it comes to using antibiotics. Overuse and misuse of antibiotics can lead to antibiotic resistance, where bacteria develop mechanisms to resist the effects of antibiotics. This makes infections harder to treat and increases the risk of disease spread, severe illness, and death. Each class of antibiotics has specific side effects ranging from mild, such as nausea and diarrhea, to severe, like allergic reactions and nephrotoxicity. It's crucial to be aware of these potential side effects and to monitor for them during treatment. Antibiotics should only be used when prescribed by a healthcare professional. It's essential to take them exactly as directed to ensure effectiveness and minimize the risk of resistance. Never use leftover antibiotics or share them with others. And there you have it. A detailed look at the different classes of antibiotics, how they work, and their specific uses. Remember, antibiotics should always be used responsibly. If you found this video helpful, don't forget to like, share, and subscribe for more educational content. See you next time.